So you just broke your front tooth and you're embarrassed to let anybody see that your front tooth is broken. So that's what we're going to talk about today. What are your options if you break your front tooth? Well, the first option is, if it's just a small chip, is fixing it with a plastic or a filling. You put that filling in there, the plastic is the same color as your tooth, and then nobody can notice that you chipped your tooth. But maybe you chipped it quite big, and if you try to do a filling to cover that whole thing, anytime you eat something, that filling or plastic could just break off. And obviously that would be quite embarrassing. In those cases, it's best to do a crown. That's where you trim around the tooth and put something that goes over the whole tooth and cement it on, and that's gonna stay really well. You can eat hard things with it, and you can live normal life and not have to worry that you might break it. And maybe you broke the tooth so far that you actually hit the nerve, and you could even see bleeding, or it could be really painful. In that case, you're gonna need to do a root canal. And what a root canal is where you take out the nerve of the tooth and you do a filling for the nerve. You put in gutta percha, on top of that you do a buildup or a post, and then you put a crown over the top of that. And that's going to allow the tooth not to get infected and to last hopefully a very long time. And then the worst case is, say you broke the tooth completely and there's only a root on it, or say you're just missing a front tooth. What are the ways to replace a missing or completely destroyed front tooth? Well, there's a few options. For example, you can get a flipper, and that's something that comes in and out. But the problem with that is it's big, it does come out, and you could be eating, it could fall out as you're eating. You know, it bothers your tongue because it's so large. So the only option, really the only reason you do a flipper, is financially, because the other two options we're going to talk about next are just, you can't afford them and you need something quick and affordable to do. But the two main options are either a bridge or an implant. And so that's what we're going to focus on today. We're going to talk about when it's better to do an implant and when it's better to do a bridge. So let's first go over the two types. An implant, that's very similar to a natural tooth. Basically, you put a titanium implant into the bone, and that implant basically is the same as the root of a tooth. And just like a root of the tooth holds the crown, or the part of the tooth that everybody sees, the implant holds the crown of the implant, which everybody sees. And so you have the implant, you let it heal for 3 months, and then you put a crown on it. Now, you can still floss an implant, you can brush an implant. If you forgot that you had an implant, lots of times implants are so real that you wouldn't even really realize that you had an implant if you completely forgot you had it done, because it's so much like a normal tooth. On the other hand, a bridge is very different. See, a bridge uses the two teeth that are adjacent to the missing tooth to hold up a fake tooth called a pontic. And so you have to put crowns on both of the adjacent teeth, and those crowns hold up that fake tooth or pontic to make it look like you're not missing a tooth. Now, with the bridge, because they're all held together, you can't floss between them because they're all connected. But you can floss underneath it, underneath where that pontic is, to make it very clear that there's no tooth connected to that pontic. So again, let's go over the advantages and disadvantages of each. Let's start with implants and the advantages. With an implant, you can floss it, like we mentioned, and brush it like a normal tooth. And doing an implant, it doesn't touch or affect any of the teeth. If for any reason the implant would fail, it doesn't bother anything else. And it also can't even get a cavity, which is great. The titanium and zirconia, they don't get cavities. And lastly, because they don't get cavities, an implant can last for a very long time. So I know what you're thinking. Well, why would anyone not do an implant? It seems like the best option is very similar to a natural tooth. Well, there are some disadvantages to doing an implant. For example, it does take a lot longer. As we mentioned, it can take 3 months to let the implant heal, and that's just a normal implant. Maybe if you had to do a sinus graft or a bone graft, it can even take much, much longer. Also, you might not always be able to do an implant. See, there's many areas, basically every area in the mouth has certain reasons you might not be able to do an implant. Like the upper back, you have sinuses, and if the sinuses are too big or the bone is too small, you might not have enough bone to put an implant in. On the lower back, you have nerves that can get very close. And again, if you don't have enough bone above that nerve, you're not going to be able to place an implant. And the front and both the top and the bottom can get very, very thin. And because it's so thin, it might not be wide enough to do an implant. So my point is, there are definite times that you might not be able to place an implant. And lastly, cosmetic work. The most common is maybe that gap is quite large and you're trying to put an implant crown there. If you make it to cover the entire gap, it might be too big. Or if you place it the size that the tooth should be, there's going to be a gap between your implant crown and your adjacent teeth. A very good comparison is if you lost a tooth and you always had gaps between your teeth, when you do an implant, you're still going to have gaps between your teeth. Otherwise, it's just going to look really, really awkward. So basically, an implant replaces your teeth very, very well, sometimes so well that it also replaces the problems you had with your previous teeth. It also can be hard to color match because you're matching just one tooth with all your other teeth, and sometimes it's really, really difficult to match with color. And lastly, if you are able to place the implant in some of the harder places, you may have to put the implant at an angle. And if you have to put the implant at an angle, putting the crown on top can be very difficult. And if you do it, it might not look great with the gums because you had to put the crown at an angle on top of the implant. And so there's definitely some disadvantages with implants, being cosmetic probably being the biggest one. Whereas bridges has some clear advantages. First is the speed. Bridges can be done in just 2 days at our clinics. We do them, so if you're from out of state and you're coming to visit our clinic, it's much better to do a bridge because we can do it nice and quick. Again, implants take 3 months. And also, as mentioned before, the aesthetic reason. Again, we mentioned how an implant is kind of replacing what you had before. So if you had gaps before, you're going to continue to have gaps. With a bridge, you might not have to worry about that. See, if the tooth you're missing is too big to be the actual size of the tooth replacing it, with an implant, that's really hard because you're replacing it with one tooth. Whereas with a bridge, you're doing 3 teeth. So you can split that gap size between 3 of the teeth. And so you can just add a little bit of a size to all 3 teeth to make it look a lot more natural and not like any individual tooth is too big. And you don't have to worry about bone position or sinus position or nerve position because none of that matters because you're not placing something in the bone. And you don't have to worry if when you extracted that tooth, if you broke the bone, because again, if you broke the bone, that would be very hard to place an implant in. But with a bridge, you don't have to worry about any of that. So as you can see, when it comes to cosmetic things, it tends to be much, much better to do bridges. And it doesn't stop there. And just think about the patient that wants 8 front perfect looking teeth and they're missing 1 tooth. Well, one option is to get 7 veneers in the tooth that they're missing to do an implant for. And at our clinic, the material we make our implant crowns out of, our normal crowns out of, our veneers, and our bridges are all of the same material. So they all look the same when it comes to coloring and everything like that. So yes, you could do, if you're doing an implant, you would need 7 veneers. But if you're doing a bridge, remember a bridge has 1 pontic, but 2 other crowns next to it. So you're really doing 3 teeth with the bridge. So if you're going to be doing 8 on top, 3 have already been taken care of. So you only need 5 veneers. So think about it. If you're going to be fixing multiple teeth, a bridge is much better because then you have to do 2 less teeth that you're fixing because they get fixed when you do the bridge. But like implants, bridges also have disadvantages. The biggest disadvantage is they can get a cavity. See, unlike an implant they can get a cavity and they're actually at pretty high risk because it's much harder to keep them clean. We mentioned you can't just floss like normal, you actually have to floss under the bridge. And some people don't do a good job at keeping their bridge clean. You're also putting a lot of stress on your neighboring teeth. Remember, these teeth are technically meant to just hold themselves. And now they're not just holding themselves, but they're holding up a fake tooth. And so there are times where you might be missing multiple teeth and a bridge that long can't be held up by just a few teeth. And so your only option would be to do implants. Also, if you're way in the back, you might not have any neighboring teeth. And if you have no neighboring teeth, your only option is to do an implant. And so, as you can see, sometimes your only option is to do an implant, and sometimes your only option is to do a bridge. And sometimes it's very more beneficial to do one or the other. And sometimes you could do either one and both would work. And so I just encourage you, before you jump the gun and go to a bridge or an implant, check on both options. And the problem with our world, especially here in the States, is there are a lot of dentists that say they don't do implants. So your only option you're going to be presented with is a bridge. And there are some dentists that don't do bridges and they only do implants. And so they might steer you in a certain direction because that's all they do. And also, please go to a dentist that specializes or at least focuses on cosmetic work. The reason I'm telling you is all the clinics before the current clinic I'm working at did not specialize in work. When we did a bridge, we just were trying to replace a missing tooth. We weren't trying to make it super beautiful. Same with an implant. And if you're going to pay the money for an implant or a bridge, at least do it to make it look really nice, because those things aren't cheap. And you can also take a look at our Clinic to Smile mission. We do have many patients flying in from all around the country to save significant money here. And we do specialize in cosmetic work, and we do everything so we can give you all the different options. As far as I am aware, we are the lowest price for implants in the entire state of Florida. And we are one of the lowest price, if not the lowest price, in the entire country for bridges. So it's definitely worth taking a look at us. And again, like I mentioned before, our cosmetic work is extremely good. That's why we have patients flying in from everywhere. We specialize in veneers and doing cosmetic stuff. So feel free to check us out, because we do offer free online consults and free in-person consults. And regardless, I just hope this video helped teach you the differences between bridges and implants and your different options and when to use one versus the other, because I feel so many patients are just being led towards one or the other without doing their proper research or the dentist really informing them. And I'm just trying to help you guys know the pros and cons for each. If you have any questions, feel free to write it in the comments and we'll try our best to get back to you as soon as possible.